I'm Dr. Jesse Ehrenfeld, an assistant professor at Vanderbilt University Medical Center, and I have with me today Kristen Eckstrand, who's a medical student at Vanderbilt. Together, we are co-leaders of an innovative effort at our institution to improve access to and quality of care for lesbian, gay, bisexual, transgender, and intersex patients. There are two significant challenges confronting the LGBTI community: access to care and disparities in health outcomes. Until the Affordable Care Act, LGBTI individuals were twice as likely to be uninsured as their counterparts, and finding providers who understand the needs of the LGBTI population remains a problem nationally. When LGBTI individuals access the healthcare system, studies have demonstrated that a majority report both bias and discrimination. Barriers in access to care, combined with the stigmatization of the community, have led to poor healthcare outcomes among the LGBTI community. These patients are then at increased risk for developing specific chronic diseases, including cardiovascular disease, certain types of cancer, and obesity. Additionally, gay and lesbian patients are 60% more likely to smoke than other men and women, and 1/3 of all adolescent males and half of all adolescent females who are LGBTI report attempting suicide. The challenges of increased rates of suicide and depression among LGBTI youth persist into adulthood.
Academic medical centers, which train the majority of our nation's healthcare professionals, are in a unique position to improve access and healthcare outcomes for LGBTI patients. Data from leading academic medical centers shows that 64% of medical students report feeling inadequately trained to care for LGBTI patients. Together, Dr. Ehrenfeld and I are working to improve access and healthcare outcomes by developing and implementing an innovative model to both identify and address opportunities for improvement at academic medical centers. At Vanderbilt, we have been working across 5 key areas: medical education, patient care, employee affairs, institutional climate, and outreach to the community. We have integrated training related to LGBTI topics into our medical school's curriculum. We have improved access to care by making LGBTI competent providers more accessible to patients through the creation of an online provider directory. We have worked with leadership to ensure that all policies and procedures take into account the needs of LGBTI patients and families, including our visitation and non-discrimination policies. Finally, we have worked to reach out to the local LGBTI community through community health fairs and other events. This model has been successful at Vanderbilt and can be easily replicated across the country.
Our hope is that ultimately this work will improve the lives of millions of LGBTI Americans.